All right, let's pull back the curtain on something truly empowering today. When we hear chronic illness, I think our minds often default to managing symptoms, right? Or struggles, just, coping day to day. But what if there's a different angle?
Mm-hmm.
A really powerful shift in perspective? What if living with a long-term health condition could actually lead someone to, well, to flourish?
That's exactly it. There's this fascinating new systematic review from late 2024. It's called Biological, Psychological, and Social Factors of Flourishing in Chronic Diseases.
Hmm.
And it really digs into this. This deep dive isn't just about survival, not at all. It's about uncovering what helps someone truly thrive, even with that chronic diagnosis hanging over them. So our mission today is really to pull out those key insights, show you how biology, psychology, and our social world all kind of weave together to create this state of flourishing.
Okay, so flourishing. What exactly is that in this context? Because it sounds maybe a bit abstract.
Yeah, it can sound that way, but the study and this pulled together findings from 19 different papers, so it's robust. They defined it quite clearly. It's not just like feeling good temporarily. It's a sustainable state combining positive feelings and good self-functioning.
Sustainable. Okay.
Right, and that's across all aspects of life. Social connections, mental well-being, physical health, even material circumstances. It's building on that whole biopsychosocial idea. Health is way more than just biology.
Right, the bigger picture.
Exactly. And what's really insightful is how practical these factors are. So kicking off with the biological factors, the review really emphasizes proactive self-management.
Okay, what does that look like?
Well, it's not just vague advice. It's about active things. Regular, moderate exercise, practices like yoga or mindfulness, and really consistently monitoring your own health, like understanding your pain levels, symptom severity, that sort of thing. And here's a key takeaway. Personal recovery, the journey you kind of shape yourself. That actually seems more important for sustained growth and flourishing than just focusing on clinical recovery alone.
That's a really powerful distinction. Personal versus clinical. It sounds like a very personalized playbook,
Uh-huh.
but maybe also daunting. Like, where do you even start on a bad day?
That's a fair point. It absolutely requires effort, but it links into the next piece, the psychological factors. The study sees these as working in two ways. They can be protective shields or they can be risks.
Okay, so what are the shields? What helps psychologically?
On the protective side, there's a strong link to what's called psychological capital. This includes things like resilience, which the study found was incredibly impactful, a huge contributor, almost a zero point 0.7 correlation, which is significant.
Wow.
Yeah. And alongside that, self-esteem, optimism, hope, these mindsets act like a buffer. Also important are autonomy, feeling in control, emotion regulation, having an energetic personality, and self-efficacy.
Self-efficacy. That's the belief in your own ability to handle things.
Right, exactly. That core belief that you can navigate the challenges that come your way. Super important.
Okay, so if those are the strengths, what about the psychological pitfalls? What works against flourishing?
Yeah, the review was clear on those two. Stress, depression, loneliness, and emotional neglect were identified as major risk factors. So managing these effectively isn't just about feeling better. It's actually crucial to prevent the illness itself from getting worse. It's about building that emotional resilience proactively.
Right, it all connects. Okay, so we've got biology, psychology. What about the outside world, the social factors?
They really complete the picture, don't they? Flourishing isn't just an inside job. It's profoundly shaped by your environment, the people around you. The study shows how social support, whether it's from family, friends, fellow patients, even healthcare professionals like paramedics, how much that influences well-being. Having strong community ties, feeling involved, it fosters this sense of maybe shared destiny, and it definitely reduces that feeling of being isolated by your illness.
Yeah, I can absolutely see that.
And connecting it back to managing the disease itself, the review stresses that good social relationships aren't just, a nice to have. They're pretty foundational. They help people flourish more easily because they get both emotional support and instrumental support.
Instrumental support,
Yeah.
meaning practical help.
Exactly. Practical help like, say, getting a ride to a doctor's appointment, help with chores, or even just someone reminding you about medication. Real-world assistance. It boils down to not feeling excluded or alone because you're ill. You can imagine maybe a patient struggling with a new diagnosis. A strong family network might step in with that practical stuff, while a peer support group offers that unique emotional understanding maybe doctors can't provide.
Yeah, different kinds of support for different needs. So ultimately, this deep dive seems to show that flourishing with a chronic illness isn't just wishful thinking. It seems genuinely achievable. But it takes this multifaceted approach, right? Making peace with the diagnosis, embracing healthy living, keeping a positive outlook, but also tackling those vulnerabilities, biological, psychological, and social.
That sums it up perfectly. It leads us to a really important question for you, the listener, to think about. How might understanding these interconnected factors really seeing health beyond just the medical side? How might that change your perspective on managing health, whether it's for yourself or perhaps for someone you care about?